Hello friends, welcome to Bone Doctor. Today's topic is bone infection, which is commonly known as osteomyelitis. We shall discuss how osteomyelitis occur, what are its symptoms, how do we diagnose osteomyelitis, and what is the treatment of osteomyelitis. First of all, let us explain what is osteomyelitis. Osteomyelitis simply can be explained as infection of the bone. Now the question is, how does the bone get infected? Most commonly, whenever any germs, that is bacteria or a fungi, enters our bloodstream, it may circulate and enter into a bone and can cause infection of that bone. This type of infection is most commonly found in children. Whenever a child encounters an infection of the lungs or infection of his GI tract, there is a gastrointestinal tract, that bacteria can travel through the blood and can infect his or her bones, causing acute osteomyelitis of the bones. This type of infection is rarely seen in adults. The most common cause of osteomyelitis in adults is an open fracture. That is a fracture in which the bones has been exposed to the air. That is, you had an accident and the skin over the bone is cut and the bone is exposed to the environment. There is a dust and the bacteria and the dirty things have entered into the bone directly. In such open fractures, osteomyelitis is very common. In other cases, we know that in most of the fractures of bones, we fixed the bones using metal rods and plates and prostheses. During fixation of the bone with metallic implants, bacteria may enter into the body, into the bones, and can cause infection of the bones in the area where we have fixed it with the metallic plates. These are the common modes of infection of the bones. Now, who are more susceptible to such infection? Persons with low immunity. For example, the diabetics. We know diabetes is increasing day by day in the population. Diabetes causes reduced immune response to germs, and diabetic patients are immunocompromised. So the persons suffering from diabetes, if they get an infection in the bones, those patients cannot handle that infection and the infection rapidly spreads in the bones, causing osteomyelitis. Other patients who suffer from immunocompromised state are patients with chronic renal disease, patients on chronic corticosteroids and other drugs, patients who are positive for HIV, etc. These patients are more prone to osteomyelitis. Now, how to diagnose osteomyelitis? Whenever a bone gets infected, the skin over the bone becomes red, the area appears to be elevated temperature than the other parts of the body, and the bone itself is very tender, that it is very painful if we touch that bone. These are generalized signs of bone infection. If a surgery has been done in that bone, for example, a fracture has been occurred and we have placed a plate or a nail in the bone, the suture, the stitching area, the area we have stitched, may show signs of pus, that is signs of oozing pus coming out from that stitch line. That is a sign of infection after surgery. If an open fracture has occurred, then the area through which the skin has been cut, we will notice pus in that cut line or around the bone. So how we confirm our diagnosis? If we can see pus coming out from the stitch line or in and around the bone, we take the pus for culture sensitivity. We try to know that what type of bacteria has infected the bone and what type of antibiotics it is sensitive to. We do some blood tests such as total leukocyte count, erythrocyte sedimentation rate, C-reactive protein test to understand the severity of the infection. X-rays are done to see the condition of the bone where the osteomyelitis has occurred. We do MRIs if the plates we have applied are MRI compatible. MRI gives a good picture of osteomyelitis. We do CT scans, which helps us to understand the status of the osteomyelitis. So this is how we get a picture of the severity of the osteomyelitis. Now, what is the treatment? Treatment of any infection is antibiotics, because it is the germs which have made a mess in the bone. So we need antibiotics to kill the germs. But in case of bone infection, the duration of antibiotics needed to totally wipe out the germs is quite long. It may take around 4 to 6 weeks for the antibiotics to work, because in the bone, the germs are very hard to kill. In the bone, germs make a biofilm which prevent penetration of antibiotics, and it prevents easy killing of the germs. So we take antibiotics for long period of time in case of osteomyelitis. Patients are also taken care of to improve his or her immune system. For example, in diabetics, we take care of his blood sugars so that high blood sugars do not impede the immune system of the patient, and we give him nutritious food and help him to recover so that his own immune system can take over the war against the germs. In few cases, antibiotics fail to work or antibiotics cannot give cure in osteomyelitis. In those cases, we require surgery. Surgery to remove the infected piece of bone out of the body and to clean the bone and to clean it out surgically from various germs. In rare cases, we have to completely remove the bone or completely remove the limb. That is known as amputation. So this is how osteomyelitis is taken care of. Osteomyelitis itself is a very critical disease because it takes a long time to heal and its sequelae is very gruesome, and in many cases osteomyelitis refuses to heal and it becomes a long lifetime bother for the patient, with the patient having a discharging sinus or pus discharge from his bone for his life. So we should be aware about his osteomyelitis and take adequate steps to prevent osteomyelitis in the first place, and if it has occurred, we should take immediate steps to prevent such long and a bad sequelae of osteomyelitis. If you have liked the video, please give it a like. If you wanted to share, please share to your friends. If you like my channel, subscribe. So take care, stay healthy. Bye bye for now.